With the rate of new infections and deaths from hepatitis C higher in Oregon than the entire U.S. as a whole, Oregon lawmakers are rushing to make life-saving drugs available, and they're asking you to help them lower what they call immoral pricing.
It's kind of a miracle that we have a cure for hepatitis C.
Sovaldi and Harvoni, two drugs that could change the life of someone who is hepatitis C positive.
The new antiviral agents are incredibly effective.
According to physicians like Dr. Peter Addisman of Gastroenterology Consultants of Medford, in as little as 6 weeks, these drugs can wipe out the possibly fatal hepatitis C virus.
The treatment is about 95+% effective.
It's an absolute breakthrough in healthcare.
But it's a breakthrough that the average person can't afford.
The average cost for treatment for one case of hepatitis C is $100,000.
It's really a problem for people who could have their lives improved or saved.
According to Dr. Addisman, because of the high prices, many insurance companies won't allow a hepatitis C patient to be treated unless their illness is far enough along. Addisman says typically into stage 3 and above.
It's a big frustration.
In part 1 of this story, we met John, who has asked us to keep his identity a secret. He shared his desire for treatment of his hepatitis C diagnosis, but says he was denied by his insurance. Because he's at level 1 and his liver has not suffered significant damage, his insurance provider won't spend the money for his treatment.
It's immoral for us to have to pay those kind of drug prices and for people to have to wait for treatment and risk their lives waiting for that treatment.
Oregon Health Authority says 80% of hepatitis C deaths in Oregon in the past 5 years occurred in persons 45 to 64 years old. Congressman Greg Walden, State Senator Dr. Alan Bates, and Senator Ron Wyden say you can make a difference in getting life-saving treatments to people who need it most. All three urge you to contact your Washington, D.C. legislators, be it Wyden, Walden, Merkley, or whoever. If any change can be enacted, it'll have to be done at the federal level. In studio, Taylor Ryan, NBC 5 News.